We appreciate you joining us today, and we welcome to the program now Wendy Bailey, Executive Director of the Mississippi Department of Mental Health. Wendy, always good to see you.
Good to see you, too.
Well, we were just talking off the air about the legislature convening here in 2 weeks from today.
That's right. January 2nd. Here we come.
And this being the first year of a new term, they stay in session or can for 4 months.
That's right.
Essentially. So they can leave early if they get all their business done, as we were talking about. But I think they got a lot of stuff to address coming into the new session. And, of course, we are going to have a new Speaker of the House, a returning Lieutenant Governor, returning Governor, some new members of the House. Not a whole lot of change over there in the Senate. So what are your priorities at the Department of Mental Health that you're going to be talking to the legislature about this year?
Well, we have had so much support from the Mississippi legislature, both from the House and the Senate and the state leaders over the last 3 years. We really have. Last year, there was some legislation, House Bill 1222, that passed, which was a comprehensive mental health bill. So we're excited to be able to share some of the results of that. It included adding court liaisons, which will help divert individuals from the court commitment process and get them the services they need in the community when that's possible. Training law enforcement in mental health, first aid, and crisis intervention team training, just giving those law enforcements another tool in their tool belt to be able to de-escalate and prevent someone from unnecessarily having to go to jail. It also required some reporting from Chancery clerks, so we're really excited about some of the legislation that passed last year to be able to show the progress. But then one piece that we're really hopeful this year is 988. It's a 3-digit behavioral health crisis line, so you can call 988 and you will get linked to a trained counselor here in Mississippi. It's a national line, but we have call centers in our state. And we really want to see more awareness brought to 988. And more people becoming aware that they can call this 24/7. So we are requesting that 988 be added to state IDs and to student IDs, college IDs, public school IDs, to where people can have that right at their fingertips.
So how are we doing, Wendy, just as a state with respect to the occurrence and the incidence of mental health? Is it getting better? Is it worsening? About the same? How are we doing?
We are seeing our length of wait improving. So 1 in 4 Mississippians, just like across the nation, 1 in 4 people have a mental health condition. So it's the same kind of pretty much across the nation, but 1 in 4. So that means, out of 4 individuals, 1 of your neighbors, your coworkers, your church members, your family members do have a mental illness. So it's really important that we bring that awareness and that attention to it. Yeah. In our state, we were struggling with the number of individuals who were waiting on a state hospital bed who had been court committed. And we saw a 55% decrease in that wait time over the last 2 years. So that is improving drastically. And we're also seeing an increase in people using intensive services in the community. And that is very positive because we want people to be able to stay in their community and not have to go to a higher level of care. So with these specific services that we've put in place in Mississippi, we're seeing a decrease in the number of people who are having to be readmitted. Okay. So that's positive.
And these services, certainly when they're critical or reach a point of urgency, they're available round the clock, right?
Yes. So around the clock is mobile crisis response teams. So you have 988 that you can call and talk to a trained counselor. But a lot of times you need someone to respond. Maybe the telephone call's not enough. You need someone to physically come out. And that's where mobile crisis response teams come in. And they are across the state. They're funded by the state, and then they're operated by the communal health centers. And they're available 24/7.
Are we kind of in line with the rest of the country with respect to this problem in our state? Are we greater, less than? Where do we stand?
It ranges on what part of the continuum of care you're looking at. Okay. So, for example, with 988, we saw about a 20% increase in the calls this past year, and that's pretty much in line with across the nation. But we had one of the top 10 highest in-state answer rates. So where many times you might call and it may be rolled to another state, about 95% of the time it's going to be answered here in Mississippi. So we were well above average with our in-state answer rate. Prevalence of mental illness, we're pretty much across the board. We do have more individuals who are underinsured or uninsured and don't have the access to care that they need, which is why making sure that we have those services available on that continuum is so important, because it all comes down to access. You need the service when you need it.
Yeah. What sort of innovations in treatment of mental health have evolved in the last few years? How's that changed, just the approach?
So we have incorporated a lot of evidence-based practices, things like PACT, or Programs of Assertive Community Treatment. And that is an intensive service that's provided in the community, and it's wrapped around the individual to keep them in the community. On the children and youth adolescent side, an evidence-based practice that we've started in the state the last several years is called Navigate, and it's for first episode psychosis. So the very first time that you have been diagnosed with schizophrenia or start those signs and those symptoms, you can be connected with a Navigate team that, again, wraps those services around you. So we've really shifted our focus on evidence-based practices and best practices where there's proven outcomes, and then making sure that those are monitored to fidelity, that we are getting the outcomes that we need and that people are getting better because of the service.
Gotcha. What about our facilities in the state of Mississippi where we have to house those mental patients? How do we handle that these days? How are we looking?
So we have 4 state hospitals, and they have 320 beds. So we have much fewer acute psychiatric beds than we had years ago, but we have 4 state hospitals. We are adding a new unit at Mississippi State Hospital for forensic services next year. It will open in the late fall of next year, and that's going to help individuals who are having to wait in jail for competency restoration. So we're seeing improvements there. On the intellectual and developmental disability side, we have regional programs that we operate across the state, and we have community homes. So we really look to focus on the individual and having them served in the least restrictive environment possible. So you have the institutional care, but then you also have the community homes. We have also added a substance use disorder unit in the last 2 years at East Mississippi State Hospital for people who need substance use treatment and need to be court committed.
Is there any kind of data, Wendy, that is available that shows just the success, where you've taken in patients, you've treated them, you've counseled with them, and you've got them fully recovered and they're independent?
Yes, and we're the last several years we have focused on being transparent. So showing the good and the progress, but also showing the gaps and where we need to focus. So we have a strategic plan for the state, and it's published on our website, and it's where you can see data related to how many people are being readmitted to a state hospital, how many people are being served in the community, are those services working? And you'll see where there's areas that it's succeeding and it's above, and then there's areas where it's at risk and we know we need to put more focus.
Yeah. So what about your finances? Do you feel like the government, the legislature is appropriating the appropriate amount of money that you need?
The last 3 years we've had budget increases, and we're very grateful for that. We may not have gotten the amount of the increase that we asked, but we are very grateful that we have not had to experience any budget cuts over the last several years.
Okay.
This last 2 years we've even received ARPA funding to be able to enhance crisis services and some other areas. This year, we are asking for a pretty significant increase related really to 2 things. That forensic unit at Mississippi State Hospital for people who have committed a crime and need to be evaluated and restored to competency. So it's the staffing of that unit. And then people who have intellectual and developmental disabilities and making sure that they could be served in the least restrictive environment and getting them enrolled on what's called the IDDD home and community-based waiver. So that's 2 of our significant funding increases.
Okay. Well, just a few seconds left. Do you support any sort of changes in the way we handle mental patients that are being incarcerated? Is there something we need to be doing that real quick?
So, yes.
As an alternative?
that we are going to be making some recommendations this year for changes with the civil commitment process.
Okay.
We do not believe that anybody should be having to wait in jail who have not committed a crime.
Okay.
So they're waiting in jail on treatment only. We do not want to see that in our state, and that's an area of focus that I hope the legislature is really going to support this year.
Yeah. Sounds like you got your plate full down there at the legislature this year.
It's full and overflowing.
Appreciate you coming in, Wendy. Thanks a lot.
Thank you.
We're stepping aside for a break, folks. Coming right back in the Element Wealth studio.